We can apply this on tuberculosis. First we see there is risk which causes outcome. In case of tuberculosis, what is risk factor? What is agent? Mycobacterium. Mycobacterium causes TB, but it needs a certain host. It needs a certain environment. We can say that mycobacterium needs a host. Which host? Susceptible, vulnerable, who is at high risk. It needs an environment to grow. When does environment becomes favorable? When immunity of host decreases or the dose of organism increases. So they are not interacting, it is pre-pathogenesis. They are present, but when they start interaction, they cause pathogenesis. Process of pathogenesis start, incubation period is completed, and sign symptoms appears, and early symptoms appears. We can say that there is fever, low-grade fever, there is cough, there is weight loss, loss of appetite. It is early pathogenesis. If you don't stop the process here, or if you don't diagnose the disease here, it will lead to late pathogenesis. What late pathogenesis can cause? Dissemination of disease. Disease may progress, and then it can have a severe outcome. In case of tuberculosis, if no treatment is done, 1/3 of people die. 1/3 people die within first year. And about 50% die within 5 years. We can see the severity of disease. So we know the natural history. We can apply intervention on tuberculosis. We can stop the risk factor. We can improve the quality of life. We can detect it at early pathogenesis. We may detect it at later pathogenesis, but it affects the prognosis. You detect as early as possible, prognosis is good. If we don't detect, person may not recover, he may die. There is recovery. There is recovery in cases of TB. People who have lesser dose of organism, whose immunity is good, they develop only infection and they recover. But people who have lesser immunity, lifestyle is compromised, quality of life is not good, there is overcrowding, there is poor nutrition, they can die. So we have to detect. So what are the advantages of natural history? Pattern of disease. It describes the pattern of disease. And when we know the pattern of disease, we can apply interventions. We can apply various interventions to control that problem. So main advantage is the pattern of disease. We know the pattern, interventions are applied. When interventions are applied, severity is reduced. Severity of disease is reduced. This is all about natural history of disease. Now